Hi everyone and welcome. It's Dr. Nigel Giam, the lead GP training program director for St Mary's Scheme and course director for Mentor Med Education and Mentor SCA. Really happy to have Ben join us today to share his SCA success story in the recent sitting. Congratulations, Ben. Really, really good to see you. You must be very relieved.
Oh, I am Nigel. Thanks so much, and yeah, absolutely. My wife said to me as soon as I got the result, is you need to contact Nigel and say thank you. So thank you very much.
No, you're most welcome. We had a lot of fun doing our sessions, but I was just having a look at the recent SCA summary report for the sitting that you've just come through a couple of months back, and unfortunately, the pass rate again has fallen. So it's clear that perhaps some people are really struggling with this exam. I know that you struggled with it also before. We're going to obviously dissect that apart, but just for the audience, maybe just a quick intro as to your journey into general practice, because you've done many things before you've kind of entered GP training.
Yes, yeah. I qualified about 15 years ago, and then had uh, after foundation went off and did non-medical stuff, and then we moved to Canada, and then during COVID. Um, got contacted by the GMC. They were looking for doctors to come back, so came back and uh, I worked in the hospitals. Then really enjoyed geriatric medicine, and I thought GP might be my area.
Yeah.
And started getting into the training, but I'd had like seven years out, so I was really had to learn
Yeah.
everything, and that was a massive challenge. But really enjoyed it. And then, as you said, I, I I came on one of your courses, and I remember you predicted at that course that I was a sort of mid 70s candidate.
Mm.
Did the exam, got 73 and a half, and I'm a real I'm over optimistic always, and I thought, that's great. I can handle this. I can do it again and pass. I didn't. I got worse the next time.
Yeah.
So got 72 my second time, and really sort of despondent about
Yeah.
how difficult the exam was, and I was obviously not preparing correctly, and
Mm.
and reached out to you, and you very kindly would sort of build me up, and went on your course again, really engaged with it, and really properly thought about the
Yeah.
messages,
Yeah.
and it started to click, yeah, so I'm just so grateful I reached out to you.
No, no, not at all. It's been my pleasure. And it's actually been such a joy to see you kind of turn the corner and really invest in these skills, which, as we always say, not just for the exam, but actually just for real life too, and real life consultations. I think one of the things that I noticed when we first started was that your data gathering often took quite a long time. There was a fair amount of kind of procrastination, over summarizing, overthinking. In terms of game changers, it became a lot slicker. And actually, for those of you who haven't actually watched Ben consult, you're very lucky because Ben and I actually ran a webinar just before your sitting, actually, just to showcase some of these skills of case priming, really staying close to the narrative. I mean, what would your game changers be to for those having to resit who are just not scoring well in terms of data gathering? What are the big game changers here?
And I should say, I improved my data gathering by 4 points, but it's still my weakest area. So and I've got, but absolutely, what you taught me was know your place in the journey. It was a
Yeah,
fantastic thing that, yeah, and just ask that question. If it's a follow up, ask that question. What was left? How was it
yeah,
left at the earlier appointment?
yeah,
They're waiting for you to ask that, and if you
yeah,
can, they just give you all of that information,
absolutely.
it's so useful.
Yeah,
And also that the notes, reading the notes, priming is so important. I genuinely in the second my second attempt at the SCA, I used the 3 minutes as a rest period and
right.
just sort of to relax before the
Yeah,
next one. I
yeah,
just
yeah, yeah, yeah.
was so on the
Sure.
back foot,
Yeah,
and just was not using it. So that was so important. Just every piece of information in there
yeah.
is there for a
It's
reason.
sentinel. It's key, isn't it? Yeah. I mean, you're so right, and it's such an intense exam, isn't it? So actually, you do have to housekeep. You do have to kind of get your breath back before the next case, but you've got to stay on point as well. It's absolutely draining. I mean, no, I don't think there's been any exam like that where you just really feel absolutely washed out after those kind of 3 hours. If we move on, I suppose, to clinical management, what were your game changers there, do you think?
I think the what really important for me was being in the moment and committing to risk was
Yeah,
something that I really sort of struggled
that's right.
to
Yeah.
grapple with,
Mm,
and that was making that decision at some point: is this serious or not serious?
serious.
And and going with it,
Yeah.
and being and that was really important, obviously, for the emergency presentations, dealing with
Mm,
those effectively,
mm,
but also not getting drawn down inappropriate use of resources for incorrect referrals
yeah.
for non-emergency
Yes.
presentations. So that
Yeah.
was, and also when you make that decision, it frees up a load of bandwidth to think about the management rather
Yeah.
than worrying about, so that was really important. Sharing
Mm,
risk, I thought, was a really good tip, that
yeah.
you have, share your thoughts, and this dilemma, you know, if there is a dilemma, like a prescribing dilemma, share it,
Yeah.
and depersonalize it, make it,
Yeah.
external, and
Yeah.
that's just a really, really useful way. And all of that helps with the interpersonal sort of the relationship.
Absolutely. Yeah. Because actually, I was just going to come on to that. It's a nice kind of segue into relating to others, because often, I suppose, if patients are coming in and they're not expecting to be told that it's serious, they're not expecting to be risk escalated, there's going to be a lot of emotional overlay that comes with that stuff that you have to work through. So relating to others isn't just about being nice, but it's being able to actually work through those emotions with patients. And real life is very emotive. You're going to have patients who come in whose expectations can't be met. We already know you're a very nice guy. I mean, we saw that on the masterclass one-to-ones. We did it on the webinar in front of 100 people, so everyone was very impressed with how calm and measured you were. What other skills do you think, other than being nice, would help you maximize your relating to others, Mark? Because a lot of people, I think, get confused with just being nice and kind as equally attaining a high mark in relating to others.
I mean, I think that you're acknowledging any emotion that showed,
Yeah.
and kind of understand where that's coming from. Um, the one real clang I had was in my first attempt,
Right.
where it was a patient who was worried about hair loss, and of
Mm.
course I've got no hair, so and this patient had hair, and so I really couldn't, and I kind of must have expressed that,
Yeah.
very
Yeah.
obvious that,
So, oh, I wish I could have been a fly on the wall of that one of Ben
I,
saying, "Well, I really can't understand where you're coming from."
yeah,
Wish I
and I,
could,
and
but I
I,
can't.
I had a clear failure. It's the only clear
Oh
failure. That was
dear.
right at the beginning, my first attempt, and it really
Right.
sort of shook me. And
Yeah.
and the feedback was I hadn't shown respect. And of course, I'd never
Mm.
do that in a real life consult. But
No, of course.
these cases are just there to try and to push your buttons, and
Push your
you've got to,
buttons.
yeah.
Absolutely. Absolutely. And I like that phrase, push your buttons, because if you're not prepared to push your buttons in study groups, then actually you're not really rising up to the challenge of what relating to others is. You're not bringing that kind of dynamic and challenge into the study groups, and indeed it won't be reflective of the SCA. I suppose just as towards the end, actually, a thought's crossed my mind, which is that a lot of people are finding it difficult to be in study groups where you are challenging each other. What would be your kind of final tip if you were to find, if you could have your time again, what would be the perfect study group for you?
Yeah, I mean that's good. I had a colleague that went through one of your courses
Mm,
earlier and passed, got a really high mark, and he he was very kind to do lots of studying with me, and it was just that,
yeah,
tough love,
yeah,
just not, um, I think the other thing I wanted to sort of squeeze in was about not not trying to learn every single edge case,
yeah,
because I think I there's there was so many different cases that you could go out and try and learn the script for. Whereas actually, 80% of the cases, there's going to be a menopause case, a depression
yeah,
case, an anxiety. Those are the cases that we can
yeah,
prepare for.
yeah.
But 20% of very unusual
I know.
conditions, you
Yeah,
could spend and I really
yeah,
went down that rabbit hole and tried to learn all of them, and I wasted a lot of time and energy
yeah.
doing that. I should have just had a safe, structured way of dealing with those edge cases.
I agree. And as I say on St Mary's, my registrars will only practice, around sort of 30 high challenge, type cases which map to the SCA blueprint, and they can modify it to kind of adapt or challenge different types of consultation behaviors. So it is definitely quality, not quantity. It is definitely about repetition and making sure that you ingrain good, positive behaviors for the consultation. Ben, it's been such a pleasure. What's the plan, CCT? I mean, this has been a long time coming. What's going to be happening now?
Yeah, I genuinely don't know. I just want the portfolio aspect is so
Yeah,
challenging for everyone.
yeah,
I'm just like grinding away, trying to get that put to bed. So, but I'm so grateful, Nigel, and it was a really dark point. I was really, really worried. I think
yeah,
I said earlier,
yeah,
I was really scared of failing it, and you
yeah.
got me over the line. So thank you very
No,
much.
no. Well, you got yourself over the line. I just gave you a little push. That's all. But it's all credit to you, mate. And I know you had other stuff happening at the time as well. And you can always feel like there's nowhere to go. But I think just for our audience out there who might be going through these sort of struggles personally, professionally, there's always hope. There's always light. There's always something you can do to make this work. It's just about having a
Absolutely.
game plan. Look, Ben, thank you so much. And again, thanks again for doing that webinar. I'll post a link down below for those of you who haven't seen it, because Ben did really, really well on that webinar. And, his success is testament to that performance. I wish you the very best. Please keep in touch as always. And
Cheers,
we'll
Uncle.
definitely
Yeah, good luck, everyone.
we'll grab that drink at some point, mate. You have a good summer.
Definitely, definitely.
Thank you. Thank
Cheers.
you.
Yep. See
Cheers.
you.
Cheers. Cheers.